Orchard Human Services, uplifting lives by counseling, educating, and caring. Why typical therapy fails for attachment disorder, including RAD and DSED, with Dr. Darleen Wodzenski.
This is Dr. Darleen Wodzenski with Orchard Human Services, here to talk a little bit about why typical therapies do not work with children with attachment disorder, and in many cases can make things much worse. Whether we're talking about RAD, or reactive attachment disorder, or DSED, disinhibited social engagement disorder, children with disordered attachment actually suffer from a developmental problem. The circumstances that interfered with the child's ability to bond with and attach to primary caregivers actually causes that child to have brain centers that are maladaptive, that don't function in the normal way, and that don't develop in the proper way. So therefore, when the child encounters any type of stimulus, the child has a response that is very atypical, unexpected, and in many times not very effective. And this is where typical therapies do not work. Typical therapies expect children to have a certain expected response. The therapy may be targeting a particular maladaptive behavior or particular individual area of developmental delay or dysfunction. But overall, the therapy expects and requires the child to have some typical and expected responses, therapeutic responses that allow the therapist to do one thing and the client to respond in a particular way that instigates the child's learning, growth, and development. But with children with disordered attachment, there are very few typical responses and expected ways that the children react to stimuli, including therapeutic interventions. So at Orchard Human Services, we do things a completely different way. You could accuse us of using therapy. We do use therapy. We use interventions, and we do developmental scaffolding. However, we take a look at the developmental missteps that occurred in the child's life early on. And everything that we do targets going back to the beginning and helping that child catch up on those missed developmental steps. So our approach is actually a developmental framework that we apply in a trans-theoretical model. That means that everything that we do focuses on the missed developmental steps, helping that child catch up developmentally, get the brain centers that are supposed to do particular jobs, doing the things they're supposed to do, or helping the child have another brain center take over that task. In one way or another, we get the child to develop the capacity to do the important things that connect with attachment. Facial recognition, emotional recognition, whether on someone's face, hearing the emotion in their voices, telling by their posture or gestures how they're feeling, knowing their own emotions, interacting with others. Communication is a big one. Being compassionate, having empathy, theory of mind. In other words, I have an idea in my head, but it might not match up with what you're thinking. These are all important things that children with disordered attachment really don't know how to do very well. So we help them catch up on all these steps. Then, within our developmental framework, we have opportunities to use moments of therapeutic intervention. And we get to choose from many different models of therapeutic intervention, many different modalities. And in that moment, while still focusing on the developmental goals and outcomes that are critical, we use individual therapeutic modalities to get little bits of work done. And by doing it this way, it almost looks like a patchwork quilt. We start filling in the gaps and help the child begin to develop strengths and abilities where before they were just a hot mess. So this is Dr. Darleen Wodzenski with Orchard Human Services doing my quick 5-minute take on why typical therapies do not work with children with disordered attachment and often make things much worse.